Hello, everyone. Role of Policy and Law in Healthcare presentation by myself, Tanjanita Detterville, October 14, 2018. Role of Policy and Law in Healthcare. Policy and law have always been fundamental in shaping the behaviors of individuals and industries, the practice of healthcare, the environments in which people live and work, and also to achieving both everyday and landmark public health improvements. Policy and law has regulated healthcare in the past, and I'm sure it will for many, many more years to come. The role of health policy and the law in today's society. First, let us define health policy. There's always decision making, there's plans, and there's actions to carry out the plans. The role of health policy and law in today's society. Healthcare policy role, it sets a foundation for healthcare, helps achieve future goals, and structure and plan on how to carry out healthcare goals. I know we have to introduce the cons, but first I have to introduce the pros. I feel like it's a catch 22 where the pros affect the cons and the cons affect the pros. It's almost like a give and take situation. So in order to understand the cons, I decided to also implement the pros as well for its healthcare policies and law. Here are some of the pros of healthcare policy and law. Improve public health, lower costs for healthcare and insurance, save lives, help people live healthier lifestyles, refocus healthcare on quality, not quantity, lower insurance premiums, force insurance companies to make careful decision making on unnecessary procedures. Implement incentive programs to provide structure and balance in healthcare. Now let's take a look at some of the cons. Administrative cost. Hospitals and health systems will have more to do on their own as they take care of the influx of new patients. Coverage. Medicare and Medicaid patients already indicate it difficult to find a physician, and coupled with a high attrition rate of doctors, finding healthcare providers to treat these new patients will be increasingly short supply. Cut in payments. Yes, there will be excessive decrease to Medicare reimbursements, around 112 billion in the ensuing years according to the Congressional Budget Office. There will also be a loss in tax breaks. These are viable methods the government issues to help hospitals meet their costs. Very interesting, isn't it? I also implemented the way that they actually come up with the deciding factor on how to implement policy and law. Is the structure. So first you want to identify the problem, and then you want an agenda setting, policy making. You always have to budget, implementation, and an evaluation of the policy and law to make sure that what's being implemented is actually working. Why policy making is needed. In order for a business, or in this case healthcare, to be successful and be utilized to its full ability, policy making is needed. Without policy, there would be no control of any aspect of healthcare. Everyone would implement and play by their own rules, whether beneficial to the patient or to themselves. Without policy in place, healthcare would be a lost cause and totally out of control. The people would suffer, and overall the United States. With policy in place, there are some problems yet to be fixed. I don't want to imagine what healthcare would look like without policies. If I had to imagine, I would imagine the movie The Walking Dead. That's not cute at all. Here are my references. That's all, folks. The end. I hope you enjoyed, and I hope I was able to bring something new to what you've also read. Um, enjoy your evening. Have a great day.